everyone, and welcome to this training session. This is going to be a proposal being made to the administration and staff for Leesburg Fire Department. The topic that I want to propose today is the initiative of bringing community paramedicine to the city of Leesburg. Community paramedicine, this is a healthcare initiative. We are looking that what this will do, this will fill the gap within our medical system. It allows paramedics to provide primary care and as well as preventative services to the people of our community. This will reduce unnecessary ER visits, hospital readmissions, all of this by making house calls, completing health assessments, managing chronic conditions, and one of the, well, in my opinion, one of the most important things is connecting patients with the appropriate resources, such as, for example, the homeless, connecting them with the certain services that they may need, whether it's shelter, drug or alcohol help, that type of thing. The whole point of this is going to be to increase the community's overall health and well-being. What is the first step? First step for this is going to be we must complete a community risk assessment and create a community risk plan. It's a comprehensive evaluation used to identify, prioritize potential hazards, vulnerabilities, all within the community. Within our community, we do have a high percentage of elderly, and we have a very high percentage of homeless. Community paramedicine could really make a difference within those demographics. The first thing we do is we identify the problem. The second thing, we look at the potential impact. Third, we look at resources. Fourth thing is planning. How are we going to do this? And then last thing is monitoring and continuing evaluation. The need for mobile integrated healthcare. The need for community paramedicine. We have to define the population and the demographics that could be helped with this program, such as I mentioned before, starting off with looking at our elderly residents, our homeless. Funding and sustainability proposal. This is big. This is probably one of the biggest items. Is it always comes down to the money. We have to look at how are we going to fund this and how are we going to keep it funded. Looking at community partners as well as budgeting within the department itself. How will the initiative be put into action? I propose that we start off with a pilot test. We do one crew and let them do their job, and then we go from there once we get that data back. And then the last thing, we'll evaluate this. We'll look at the questionnaires, the surveys, and we'll make any adjustments that are needed. City of Leesburg Fire Department coverage area, we're talking about upwards to 40,000 residents. Funding. I propose that the fire department establish a coverage of 40% cost participation, and that we also look at receiving additional funding from healthcare partners in the area. Our two main partners are going to be UF Health Leesburg, our local hospital, and then Life Streams, which is our local addiction and mental health hospital. I also want to look at local businesses. I want to poll them to find out their interest in being a part of the funding. We have 6 major events that happen within the downtown area, within the city. I also want to propose fundraisers that are held during those events. We have done smaller fundraisers at those events, and we know exactly how much money that can be made. Grants are also going to be applied for the Center for Medicaid, Medicare, Home and Community-Based Services to also help out with that. Implementation. One of the first things we're going to do, we're going to start off with a pilot program. I'd like to have that rolled out within 6 months. Getting it out to those demographics, we're going to utilize social media, local public access television channel. We are going to use community centers, posting boards. We're going to get it out there, kind of like a grassroots effort, but I think that's how we need to start off. How will this help the community? This is one of the things that we're going to have to put out there because people are going to want to know. Reduced healthcare costs. Community paramedics can help prevent unnecessary emergency room visits and hospital admissions. There are a lot of people in today's society and today's economy that they use 911 as their primary care. They use emergency departments as their primary care. Efficient resource allocation. Diverting non-emergency cases away from the ER, we can hopefully help alleviate the strain on those healthcare resources, allowing hospitals to focus on treating more acute cases. This is also going to be a part of alleviating the strain on the 911 system itself. Preventative care. We can be proactive, address health issues before they require costly medical interventions. We're going to do this through education, screening, and interventions within the community setting. And then improve patient outcomes. Timely and proper care for these people that will help reduce the likelihood of having to go into the emergency department and as well as readmissions. How are we going to get there? Well, we have to prepare the staff. We have to do proper training. It's going to require advanced protocols beyond our standard local protocols. This is going to include additional classes on learning how to help the community with health promotion. We're going to have to become educated in that. Community resources. We have to be able to list and tell these people where they go, how do they get there. We're going to have names, numbers, contacts. Chronic disease management education. Those community paramedics, they're going to have to be well versed in a wide range of chronic disease. Preventative care education. We're going to need community paramedics that are able to teach these people. And then behavioral health education. Whenever we go to the home, whenever we go to wherever that patient is, we're going to have to know how to deal with behavioral health problems. And one thing, whoever these crews are, whoever this staff is, continuing education and professional development is going to have to be a mainstay. They will have to continue to stay up on it. Quantitative data collection. This is how we're going to see how we're doing. This is going to be the data, the initial data that we're going to have to get to prove that we are making a difference to the positive. Initial data collection will occur every 3 months during the pilot test of the project. This is going to include number of citizens contacted within that initiative, how many 911 calls versus non-emergency calls. And one thing that we're going to be able to utilize now is, since we have gone with the ESO software, it is going to make it a lot easier for us to extract this data and put together the information that we need for presentation. Qualitative data, we're going to develop questionnaires that are going to be completed after each contact. We're going to develop online surveys that will be made available for the residents. We'll start out with the city website. All social media that we have, the way that we're going to get the word out there, we're going to include this link so people have access to this information, and they're also able to access the questionnaires and surveys this way. Data usage from these evaluations and surveys. It's going to create ways for community paramedics to submit feedback on their experiences, recommendations for improvement. We need to hear from the staff, from their side of things. How is this working? Use these comments to improve the program, deal with any kind of concerns, and, well, we're going to have to think about retention. We want to keep these people in this position doing this job. Assess the impact of community paramedics on health outcomes, response times. Different areas are going to have different access. Some areas they have easy access to medical care. Some do not. Assess the program's efficacy in meeting the region's specific healthcare needs. Are we getting the job done? Engage key stakeholders, government agencies, healthcare organizations. Collaborate with these stakeholders. We need to keep them informed. It's my experience that if we keep them informed, we keep them up to speed on it, we show the progression, then there's better chance that they're gonna buy in. Short-term and long-term results. Short-term, monitor the number of referrals made by paramedics to the appropriate healthcare facilities and services. Ensure that the patients receive the care that they need. Measure any early signs of public health outcomes. Fewer unnecessary hospitalizations, 911 calls. We need that data. Create a long-term sustainability plan for this program. How are we going to keep it going? All of this data needs to come down together, and it will keep it going. Identify ways to solve any difficulties and make any modifications after we reassess it. In conclusion, implementing a community paramedicine program in this area, it does have enormous potential for increasing healthcare access, emergency response, and public health. Through this project, trained community paramedics, they're going to be in a position to provide prompt, appropriate medical care. Stakeholders such as I mentioned before, the government agencies, healthcare providers, community leaders, citizens, we want to bring them all together, and then we will get more buy-in with this. We'll get more support. And that is my proposal. Thank you very much. Take care.